that our joint efforts will soon bring us to a turning point in our fight against the coronavirus.
At an event forced online for the first time because of the pandemic, the response to the crisis was front and center. G20 leaders recommitted to helping developing countries through COVID, including with a vaccine.
Even as Canada secures record amounts of vaccines for ourselves, we're also ensuring that they're going to be available for the world's most vulnerable people.
Under our existing agreements, we expect to be receiving 6 million doses by March 31st.
But when those shipments arrive depends on when the vaccine is approved, and then the question remains, who gets them first?
For now, we don't have enough vaccines for all of Canadians, and so we're going to start by vaccinating the most vulnerable.
It's up to provinces and territories to hammer out the logistics. Manitoba's premier wants a consistent approach across the country.
We need a national criteria established that is the same from PEI right to Nunavut.
Do we have a fever today?
No.
Any approach will look different from the last major immunization efforts 11 years ago for H1N1. In 2009, millions lined up for the shot. 40% of Canadians were vaccinated within 5 months.
The fact that we're not going to be able to do a mass vaccination campaign like when we were doing for H1N1, for instance, because then, putting people together increases the risk of spreading COVID.
Quash Tan says that even when a vaccine is approved, Canadians will still have to wear masks and physically distance for at least another year or so. That's how long it could take to vaccinate the bulk of the population if 2 doses are necessary. Ashley Burke, CBC News, Ottawa.
As we often do, let's turn to Dr. Isaac Bogosh, an infectious disease specialist with the University Health Network in Toronto. And Dr. Bogosh, when that first group of people get the vaccine in long-term care, for example, what will the impact be on the wider population?
Well, certainly that'll be a tremendous effort and will have a huge positive effect. We know, for example, people in long-term care account for about 80% of the deaths in Canada, so it will protect the most vulnerable of our vulnerable populations. But it will also have a pretty impressive spillover effect. We know for the vaccine to reach levels of herd immunity in a community, we'll need about 60 or 70% of the people to be vaccinated. We're not going to get anywhere close to that with the first wave of vaccines. But by helping protect the most vulnerable populations, we'll save lives. And it'll also take a lot of pressure off of the healthcare system as well. So I think that's a very important point, such that we don't start to get into scenarios where we're reaching or exceeding healthcare capacity like we're doing in much of the country right now.
I'm already hearing from people who say they're a little hesitant about being among the first to take the vaccine. How will you try to reassure your patients?
I really think that we need some good education and transparent communication about what these vaccines do, how they were tested, the trial results, the fact that tens and tens and tens of thousands of people have had them, and just really discuss in a very clear and open manner what we can expect and what we can't expect, and just have a very transparent conversation about what these are. And I think with some information and actually listening to what people's concerns are and addressing those, I think we can sway a lot of people who might be on the fence about this.
As always, great advice, Dr. Bogosh. Thank you.
My pleasure.